Witam Państwa bardzo serdecznie. Dziś gościem Medexpressu jest profesor Petera Hillmena, specjalista hematoonkologii z Uniwersytetu w Leeds. Hello, professor. It's a pleasure to have you here.
Hello, Thomas. Thanks for the invitation.
Professor, after listening to the voice of Polish clinicians, how would you assess the situation of Polish patients with chronic lymphocytic leukemia in comparison with the situation of patients in Great Britain?
Yeah, I mean, you have some very strong hematology specialists in Poland who I know well. The issue for chronic lymphocytic leukemia, or CLL, is that the treatment has been advancing very rapidly with new therapies being developed, and I think in the UK now we have access to all of the new drugs for our patients, mostly when we need to use them, whereas I think in Poland they do not have access to the new targeted treatments as of yet, and that will limit the Polish hematologist's ability to treat the patients to the best.
Which of the recently emerging hematoonkological therapies provide the best chance of overcoming the disease or a long and active life?
Well, at the moment there are two main types of treatment that have been developed for CLL, which are based on understanding what's gone wrong in the leukemia cell and specifically targeting the leukemia cell. So one of them, of the new drugs, is a drug called venetoclax, which is a drug which targets and makes the cells kill themselves. So it targets a pathway in the cell which usually encourages cells to die, but the leukemia cells have switched that pathway off so that they can't die normally. So rather than dying, the cells accumulate. So venetoclax plus an antibody called obinutuzumab can be given as an oral therapy in terms of the venetoclax for 12 months, and patients can have deep remissions which last for a prolonged period of time. The other type of therapy stops the cells growing, so we also know that the cells in leukemia grow too effectively and for too much, and we have drugs that will interfere with that pathway and switch it off. The first one being ibrutinib and one or two other similar drugs, but those drugs are given continuously until disease progression. So both these two classes of drugs have made a dramatic effect for our patients with CLL.
Thank you for those information, Professor, and for your time.
Thank you.